For typical traditional behaviour management techniques to work, a child needs, all of these ones that the Triple P program suggests. A child needs to have an understanding of future earning or deferred gratification. They need to have some degree of impulse control. They need to be able to understand cause and effect, have some understanding of their impact on others, have some concept of time, be able to regulate their emotional responses. And a typical child with FASD doesn't have these skills. So the following often are rarely successful for that reason. One of the key things to managing behavioural problems in FASD is about prevention. And although that sounds easier said than done, many children with FASD are easily overwhelmed by their environment. They have sensory integration difficulties. And a lot of the meltdowns and things you see in FASD are caused by environmental and external triggers. So pre-planning, although it's hard work, and analysing triggers and that kind of thing, it is the key to trying to minimise these difficulties. Preparation, such as photographs of people, places to prepare a child for upcoming events, maintaining a routine, reassuring and repetition are key for learning and managing these kind of things with children with FASD. In terms of meltdowns, reducing sensory overload is one of the key important factors. Children with FASD often have difficulty filtering and screening out background interference. It's about helping them to learn self-soothing techniques. It's about factoring in explosion times during and after school, really, really important. Building in movement breaks at school is really important. Doing little distraction breaks in the classroom can be really helpful, and these can be masked by the teacher sort of saying, oh, can you just go over and sharpen 10 pencils for me, or can you just take that to the office, So that doesn't make a child feel different, but it enables them to just get up, have a few moments for a break, and then come back again. And those kind of things are vital for children with FASD. Other things are too many choices can be a difficulty, particularly for younger children with FASD. To make a choice, you've got to be able to hold two things in mind at once, which is tricky as it is if you've got a working memory that's impaired. Then you've got to, make a choice out of those two things. So it's better to give closed or limited choices. Even better with little ones is to hold up to physical things for them to choose. So you're taking out that kind of the working memory loading from the choices. Transitions are another difficulty as well. Children with FASD can become stuck on one activity and struggle to move on to another. That kind of stuckness is part of an executive functioning deficit, and it's something that we assess when we're looking at the neuropsychological profile of children with FASD, where they can be doing something or problem solving, and this can be really common in the classroom. But even though they know what they're doing isn't working, they struggle to move on and do something else, so they become very, very repetitive and need somebody else to support them to move their thinking on. Visual schedules could be helpful in the classroom, SAM timers for things like screen time, bath times and that kind of thing. A lot of things that you would use for autism are helpful for children with FASD as well. The other thing I get asked a lot of is sort of using time out. And the thing with time out is it doesn't help children with FASD to self-regulate. Sometimes it can even make things worse because of that struggling to calm themselves down. So we always suggest, helping them to build a nice, calm, cosy place. And this is good to do at school as well. Helping them to build like a little cave that they can sort of have some ownership over. And helping them to then recognise when they're starting to become dysregulated, when they're starting to struggle, that they can be guided to go to that place to be able to calm down and get back in touch with sort of what's going on and that kind of thing. And so this shouldn't be used as a punishment as such, it should be more used as a way to help children to learn when to recognise when things are becoming tricky and to be able to take themselves out of the situation and have support to do that. No matter how, I say this as a parent of 3 boys myself, it doesn't always work, but no matter how frustrating the situation is, shouting and losing the plot doesn't actually help. And as parents and as teachers, we always say we need to be bigger, stronger, calmer and containing, even when we don't feel like that. I don't know if anybody's seen the circle of security stuff. There's a website, if you Google circle of security, And although this one's about younger children, I think it's a really nice thing as parents just to remind ourselves of that we're a child's secure base, FASD or no FASD. We need to sort of support them going out into the world, but also always being bigger, stronger, wiser and kind, and taking charge when we need to, whatever that means. And organising feelings, as it says there, even though that sort of depicts a younger child, is a really important thing for children with FASD. But I'd definitely have a look at this stuff because it's got lots of information on this website. When prevention didn't work and a meltdown is happening, what we suggest is to get down near your child if you can. Calmly and firmly labelling the emotion can be helpful. Saying something like it looks like you are feeling is really good, rather than telling them that that's what they're feeling. You're suggesting that that's what it looks like. The next bit is a lot of guesswork. What can help some children doesn't help others. So whether that's firm touch, whether that's light touch, whether that's no contact or just being there. It's about being calm, being with them, whatever that may be, and then when the child is calm, then distracting. It's worth remembering that learning from past mistakes is a challenge for children with FASD, so that kind of going at them then isn't going to change anything. It's more about helping them to recognise over time when these meltdowns are going to happen and being able to steer off of it rather than punishing it aftermath. So it's about reinforcing positive behaviour through repetition, through praise, and then managing the meltdowns as best you can when they happen. Many children with FASD would say you can talk the talk, which sometimes being so verbally able can mask the difficulties underneath, and this can be really difficult in school. Particularly when a child appears very able because they're telling their teacher, "Oh, I can do that, that's fine, no, it's fine, it's all good." But actually, and often during neuropsych assessment, many children, if you're setting up a problem-solving task to see how they manage it, they will tell you exactly what they're going to do, which sounds absolutely fine. But when it comes to actually doing it, it all falls apart. And that is the executive functioning deficit, because they can say it, but they can't actually often follow that through, plan out, sequence a plan of action, and then see that through to the end. And in school, teachers can't understand that. I think they often feel that if you say you can do it, why aren't you then doing it? And I think that's a really important bit to sort of ram home when you're teaching a child with FASD. But just because they say they can do it doesn't necessarily mean that they're going to be able to follow that through. And what's often reported as won't follow instructions is more than likely to be can't follow instructions, but for all of those difficulties on there. Just quickly, friendships and social life. Children with FASD can struggle with maintaining friendships, and it's really important to try to support that by to stay in friendships with shared interests, shared hobbies, rehearsing conversations, and just like a child with autism, continual rehearsal for new situations and what's going to happen, what might happen, and what's going to be expected of them is really important. The most important take-home message is remember to halve your child's chronological age when you're pitching your expectations of them, particularly socially and emotionally. So if your child is 8, they're actually 4 in terms of their ability to respond emotionally and socially. Pitch your behaviour management strategies at that level, pitch how you're expecting them to react to things at that level, and that can reduce your frustration as well as theirs, because your expectations are more realistic then. And most importantly, in terms of their social vulnerability, if you do that halving the age, if you wouldn't expect your 4-year-old to go walk to the shop, don't expect your 8-year-old to do it. And that's so important, that need for more supervision, both at home but also at school, particularly at break times, lunch times, that kind of thing. I get asked about the future a lot for children with FASD, and you can't make any guarantees. FASD is a spectrum, as you know, much like ASD. Some, more severe cases of children with FAS may not be able to live independently because they're too socially vulnerable, because of the difficulties they have with executive functioning and general learning disability. and many others can live independently, or what we might call interdependently, where they can live independently to some extent, but may need a bit of support with money management, all of those kind of things that require high levels of executive functioning to make sure that they're managing those kind of things okay. So, and the important thing again is about having that, if they need it, with having that diagnosis, having access to adult services.